My name is Stephanie Bryant. Today I'm giving my informative speech. If children have the ability to ignore all odds and percentages, then maybe we can all learn from them. When you think about it, what other choice is there but to hope? We have two options, medically and emotionally, give up or fight. 4 to 6 children are diagnosed with cancer a day, and 7 children a day die from cancer. On December 3rd, 2010, my nephew Hayden was diagnosed with leukemia. It was a complete shock and turned the whole family's world upside down. Hayden was taken to his pediatrician for a consult because he was having tremors in his hands. The morning of his appointment, he spiked a fever of 102.6. After running virus tests and the results coming back negative, blood tests were then ran. When the results came back, Hayden's red blood cell and platelet counts were really low. After going back to the pathologist the following day, Hayden was diagnosed with leukemia at the age of 2. Before I get into the content of my speech, I would like to show a slideshow of Hayden's journey through the years. In this speech, I will be discussing with you the symptoms, treatments, and side effects of childhood leukemia, which Hayden is still going through. I hope that through this speech you will gain more knowledge of childhood leukemia and be encouraged to raise your awareness. The first topic I will be discussing is the symptoms children have with leukemia. According to the American Cancer Society's article on symptoms and signs of childhood leukemia, some common symptoms are easy bleeding, bruising, anemia, and fever. A child who has leukemia may experience regular nosebleeds, bleeding gums, or even bleed excessive amounts from small cuts. A child with leukemia could also begin to bruise very easily, even by the smallest bumps or falls. Another common symptom is anemia, which is the shortage of red blood cells. This can cause a child to feel tired, weak, lightheaded, have pale skin, and even experience a shortness of breath. A child who has leukemia could also experience high fevers more frequently than a child who does not have leukemia. These fevers usually are caused by infection and sometimes cannot be improved by antibiotics. This is because a child with leukemia does not have normal white blood cell counts and cannot fight off the infection. Most children with leukemia have a high number of white blood cells, but they are still unable to protect against infections the way normal white blood cells do. Fever is not only caused by infection, but can also be caused by leukemia cells releasing chemicals into the child's body. Other symptoms that children with leukemia may experience include bone or joint pain, swelling of the abdomen, loss of appetite, weight loss, swollen lymph nodes, coughing or trouble breathing, headache, seizures, vomiting, rashes, gum problems, and extreme fatigue and weakness. After being diagnosed, treatments need to be started immediately. The 3 treatments that are used are chemotherapy, radiation, and transplants. According to Nancy Keene in her book, Childhood Leukemia, a guide for families, friends, and caregivers, chemotherapy is the use of drugs singly or in combination to destroy or disrupt the growth of cancer cells without permanently damaging normal cells. Cancer cells reproduce uncontrollably and grow in unpredictable ways. They invade surrounding tissue and can travel in blood or lymph to lodge in other parts of the body. All chemotherapy drugs work in some way to interfere with the ability of cancer cells to live, divide, and multiply. Another form of treatment used for leukemia is radiation. This is when doctors use high-energy X-rays to kill cancer cells. A large machine called a linear accelerator directs X-rays to the precise portion of the body needing treatment. Radiation can cause long-term side effects on the children who have these treatments, therefore not many children are able to use this method. But those that can are children who are at high risk of relapse or who have already relapsed. The method of stem cell transplantation, which includes bone marrow transplants, is another common form of treating leukemia. There are 3 sources to stem cells: blood, bone marrow, or cord blood. Through this method, a child goes through chemotherapy and normal stem cells are injected into the child's veins. Although transplants can be life-saving, they are highly expensive, technically complex, and can be potentially life-threatening. The treatments do not come without danger. These dangers include short-term, long-term, and effects on the family. According to the American Cancer Society's article regarding children's diagnosed with cancer, late effects of cancer treatment, there are many short-term and long-term effects associated with chemotherapy, radiation, and transplants. Short-term effects of treatments include low blood cell counts, nausea, diarrhea, or hair loss. These short-term side effects usually go away over time after treatment is over. Treatments of cancer have many long-term effects as well. These include learning disabilities, behavior problems, problems with memory and attention, as well as poor hand-eye coordination. Hearing and eyesight are also affected after treatment is over. This can include ringing in the ear, dizziness, as well as watery eyes and trouble seeing at night. Growth development, thyroid, muscles, bones, sexual development, fertility, cardiovascular system, lungs, teeth, second cancers, and emotional issues are all long-term effects that children who struggle with cancer have to deal with throughout their entire life. Children who have cancer are not the only ones who are affected by this disease. Family and friends are affected too. Nancy King stated in her book that the diagnosis of leukemia creates a ripple effect, first touching the immediate family, then extended family, friends, co-workers, schoolmates, church members, and the entire community. The family of a child with leukemia have to deal with a responsibility they have never dealt with before. Supporting and taking care of a child with leukemia can have a lot of stress and cause emotional problems for them as well. Always having to fear for your child's life and have to explain to them what is going on can be extremely hard on not just the parents but siblings and extended family as well. Having a child with leukemia is not just for the time of treatment or just part of their life for a short period of time, but follows them for the rest of their lives. They not only experience the symptoms that come along with leukemia, but they have to go through the treatments that make them sick and puts chemicals into their bodies. Children who have leukemia are not able to have a normal childhood as most children do, and they do not have the opportunity to have a normal adulthood life either because of all the long-term effects leukemia leaves behind. Families and friends as well as the child are always going to be stressed and have to deal with this disease, not just until the doctors say there is no more cancer. Relapse is the harshest word a child and their family dealing with leukemia could ever hear. After discussing childhood leukemia with you, I hope you now understand and are more aware of the reality of childhood leukemia and what it can do to a child's life. Thank you.
7 minutes.